You are live on YouTube.
Okay, good afternoon. I'm going to call the government operations meeting to order. I see some of the supervisors are eating some fruit. Just don't make a chocolate cake. That's, of course, we've never had any, but some people seem to think we do. I'd like to entertain a motion to approve the meeting minutes of the prior meeting. Motion by Mr. Leggett, second by, I'll second that. All in favor? Aye. Aye. Opposed? Okay, carried. Okay, we're gonna start right off with Pam Vogel. So please pull out your, I believe she just handed you an updated agenda.
Is that updated from the one we got the other day?
Yes, right, yes, since, rather it does say revised at the top of it, let's make sure you do have it. You see that?
It should say revised. Mr. Wild, did you have yours?
Yep,
I have it, so I'll throw that one
sorry,
away.
didn't mean to speak for you.
Okay, all right, so we have that. So Pam, why don't you get started?
Thank you, Mr. Chairman. Well, I would have to say since our last meeting there, it's been a little bit bumpy in terms of personnel in the county clerk's office. Out of 5 positions, we had 3 resignations, which isn't a terribly exciting time for any of us. As you know, we came in July. Sue Ann came here in August in my absence, and in addition, I'm back here today. In discussing the positions, we have in the clerk's office, on the clerk's side, 2 positions that sound very similar. One would be legal recording clerk, and one would be recording clerk. All positions, both positions work out of the same pool of information, if you would. There are changes in the down the road in terms of the final tasks that occur. So example, a legal recording clerk is on the front end with the task of a deed or even a court filing. They are on the front end of it, looking at it, accepting it, receiving it, those kinds of steps. Statute requires that we have a separation of certain duties that have to do with the recording, and those are where the recording process and the filing process involve indexing, same document, indexing, imaging, a verification process that all has to be done, and the workflow. And ultimately, the final disposition, so to speak, of that document, what is happening with it in the end. Is it a recorded document going back to the individual? Is it a filed document staying in the clerk's office? So similarities, same documents, slightly different tasks. And they can weave back and forth. And what happened this year in the new position that I just got a resignation on, the gentleman was a recording clerk, and yet need placed him in the legal end, acceptance. So rather than have with just a small number of positions having 2 separate titles, it seemed that this would be a good time to consolidate that or change that one position of his from recording clerk to legal recording clerk.
I make the motion.
Okay, motion by Mr. Leggett, second by me. Okay, discussion?
So,
Seeing none?
or is there any, and then this position would be filled. There's a vacancy then to fill this position due to resignation.
Yes, we would follow that with, a notice to fill for legal recording clerk.
No, I would, Mr. Chairman,
Yes,
I would only ask if the administrator has any input on this.
okay, I'll ask that question. Mr. Administrator, do you have any input?
I support the request.
Okay. Okay.
Thank you very much.
All right, all in favor? I'll call the question.
Aye.
Opposed? Carried. Okay, that was easy, Pam.
Okay, thank you very much. I appreciate it. Maybe there's some benefit to writing all of this in advance.
Sure.
I hope so. I hope so. I mentioned we had the changes. Good news. The one fill has gone very well. A second fill, I am asking for an extension on that. The individual is a former employee of Warren County Clerk's Office, resigned some time ago for childcare, et cetera, is returning, but has caught up in this COVID routine right now. And so I won't see her back for a little bit. I'm hoping certainly by the end of December, but I know that the current position does expire on January 19th, so we'd like to extend.
Actually, I think we might have skipped over B.
Yeah.
On the notice to fill.
Yes, we did skip over B. We're on B now, Pam?
So I'll
Okay.
make the motion to notice to fill legal recording clerk number 2.
Okay, I'll second that motion.
Yeah.
Any discussion on that? Okay, no discussion. I'll call the question. All in favor?
Aye.
Opposed? Carried. Okay, now we can go to where we were, which is C. Correct.
Okay, I apologize for that.
That's okay.
I thought we were consolidating, but that's okay. So this is legal recording clerk. It's a notice to fill. It's an extension, just to make sure that we don't get caught in January. I'm hoping that everything is settled before the end of the year, but in the event that we get caught in January, I'd like us to be able to move forward if we have to.
So move.
Moved by Supervisor Leggett, second by Supervisor Beatty. Any discussion? Okay, I'll call the question. All in favor?
Aye.
Opposed? Carried.
Item D,
Item D on your agenda, correct?
this is the revision and addition to this current agenda. It is a transfer of funds from outside the object code. It is taking $1,500 from full-time salaries and putting it into the postage. When the 2021 budget was put together, there was a reduction in postage. We discussed it when that happened last fall. We were hoping that we would make it through with it, but the reality was I felt pretty certain that we wouldn't. We have 3 months remaining and we are definitely short. I have moved money around within the object code, within the point force. There won't be enough to get us there. So
Move it.
the request is for the transfer of funds.
Okay, moved by Supervisor Leggett, second by Supervisor Beatty. Any discussion?
And then this goes on to finance from here. Does this go directly on to?
It's a budget
It
transfer.
goes to finance.
It will have to go to finance.
Thank you.
Okay,
Okay, seeing no more discussion, I'll call the question. All in favor?
Aye.
Opposed? Carried.
okay. Thank you very much. So the final item is really just to bring to your attention what I was pointing out at the beginning of our meeting today was the potential to reconfigure the clerk's organizational chart to consolidate these positions overall and obviously and potentially get involved in a level position. And that has been done in a few times in this last year. I've had some discussion with the personnel officer. We kind of had a mini discussion of it in August, but it wasn't a good time to engage in that. But I think, you know, with the changes that we were experiencing, this is a good time for me to re-examine it and come back to this body after the first of the year with the results and see what our new organizational chart would look like. So over the next 6-8 weeks, that's what I'd like to do.
I think that's a sound project.
Okay.
Yeah. I agree that you should go forward with that. Is there any other discussion on that?
Good
Oh.
time.
Okay, good timing. Yeah.
Okay.
Okay, thank you, Pam.
Thank you very much. You all have a wonderful Thanksgiving.
Thank you. You too.
You too, Pam.
Okay, very nice. Okay, now at this point of the meeting, I'm going to turn it over to Ryan Moore, our county administrator. He wants, there's something we'd like to discuss or get through for in government ops with Janelle.
Yes, sir.
So, Mr. Moore?
Would you like me to go briefly into one of the other pending items while we wait for Janelle to
Sure.
pop on?
Yes, why don't you? Which one are you going to go to?
Whichever one you'd like, sir.
How about number five? Five, two.
From number 5-2. Okay. This question, this is actually something that Supervisor Bruno brought to this committee. And it was a concept he had seen in a different county where in the course of discussing that proposal that came from Cattaraugus County, we got into discussion of a mission statement. Warren County lacks a mission statement. Not all counties have mission statements. And I was asked, along with the planning department staff, to take a look at some of the other counties' mission statements, which we did. Ethan Gaddy did some good research, and he came up with, I could read them if you'd like me to, but I don't necessarily need to, up to your call, Mr. Chairman. I looked at a county in Virginia, one in Connecticut, North Carolina, Florida, 2 counties in Minnesota, and a county in the state of
Why
Washington.
don't you pick out two and read?
Sure,
please?
sure. Well, let me get the first 2. Dinwiddie County, Virginia. Their mission statement is: the mission of Dinwiddie County government is to build our community through a commitment to excellence in public service. Fairly
Simplistic and to
fairly
the point.
simplistic, yeah.
Okay.
Marin County, California. Let's see their mission statement. The mission of the County of Marin is to provide excellent services that support healthy, safe, and sustainable communities, preserve Marin's unique environmental heritage, and encourage meaningful participation in the governance of the county by all. Would you like me to do a few more?
Yeah, do a couple more
Okay.
without objection.
Here is Wayne County, North Carolina. The mission of the Board of Commissioners is to provide quality public services in a cost-effective manner through innovation, leadership, and the cooperation of dedicated people. Here's Brevard County, Florida. Our mission is to contribute to enhancing and ensuring Brevard's quality of life today and always. Another simple one. One more?
One more.
All right. This is Hennepin County, Minnesota. By putting the customer first, Hennepin County employees work every day to achieve our mission, vision, and goals. We strive to improve our services through proactive, innovative public stewardship. The mission of Hennepin County is to enhance the health, safety, and quality of life of our residents and communities in a respectful, efficient, and fiscally responsible way. Okay. So I took a look at this task. I got some ideas from those counties, and I took a look at this task as when we talk about our mission, it should be about what we do from the perspective of the services that we provide. It should also tie into how we pay for it, which is just as important as what we do, and it should also speak to how we do it. Our attitude and what we do, our mindset and that we bring to the job every day. So what I came up with, and no pride of ownership, we can kick it around. We can get more people involved if you'd like more people involved. But my best crack at a mission statement for us would be: Warren County government is dedicated to protecting and enhancing our residents' quality of life by providing excellent services in a cost-effective manner, guided by the principle that county funds belong to our taxpayers and not to the county government. We work for our taxpayers and we serve them with humility, respect, and professionalism at all times.
Move it to the floor to be adopted? No. Good. That's pretty good. I covered the bases and keeps focused.
Mr. Wild?
Mr. Chair, I would like to, if it's at the pleasure of this committee, I'd like to see all of the different responses in different counties that have those mission statements. Mission statements are pretty powerful. They're supposed to be. And I believe we need to get more involved in determining what that mission statement should be. So it's a little premature. I like what you said, Ryan. But I'd like to dig into it a little bit more to get a sense. And then also, maybe what we could do is come up with 3 or 4 that we like and present it to the full board and get their feedback before we start going too quickly along this line.
Chairman, I'd help Mr. Supervisor Wild with that.
So you'd like to have all of them sent, right, Mr. Wild, all the current ones that he's researched,
Yeah,
correct?
it's what, about 20 or something like that?
No, I read 5 out of 7. There were 7 of them.
Okay. I'd like to see them as well, some maybe that you discarded. Were there any that you saw that discarded? You said Ethan only gave you 7?
No, Ethan gave me 7.
Okay.
So would you send those along to
Sure.
the committee? And put that on the agenda, please, for next month, that we have time to obviously look them over. And I would ask that the committee submit or tweak any suggestion for the mission statement they may have. So, Mr. Wild or Mr. Leggett or anyone else, Mr. Diamond or anyone wants to tweak any of the 7 and or submit a new one entirely, or go with Mr. Moore's, we need that input. And then we can hammer it out as a committee and then present one to the board, hopefully. And would you also make sure you send it to Mr. Bruno, because this was his initial foray into having a mission statement for the county, which I thought was a good idea. Chairwoman Seaver, do you have a question?
Just in the interest of it impacting all the members of the board, could it just be sent out to the whole board?
Sure.
I mean, I am sending that email out as soon as we're done with the clerical redlining from Amanda for the standing rules to go to the whole board. I mean, I can certainly make reference to it. I guess you probably don't want to, I was going to suggest putting it in it, but it sounds like maybe it would be too much in one email to also have that in there.
Yeah,
So,
I think separate emails would be good.
but I think to the whole board, I mean, this is
Mhm.
our,
Yep, no, I have
Mission statement.
no qualms. If the committee's fine with that, then the whole board receiving this project and asking for their input. We may get some, we may get none, but everyone has an opportunity to chime in. That sounds good. Okay, what else? I see Janelle's on.
Yes,
on the phone now.
Janelle is on, so let me speak to, the chairwoman and I were invited onto a conference call last night with other county leaders in the region. Governor Hochul led off the call, essentially saying that we're approaching the holidays, when last year at this time COVID had an uptick. We are already at a level statewide that is higher than where we were at this point last year. And the governor basically stated that they view local officials as their partners, and they would like our ideas for how the state can better partner with us. So the officials on the call who spoke up, the chairwoman and I were 2 of them, Chairman Hall and Washington County, a few others. One of the themes that definitely came through for this area, Warren, Washington, as well as the surrounding counties, is we really would like the state to restore a mass vaccination site. Currently, you have doctors, pharmacies who are doing this. You also have a lot of the burden is falling on the local public health officials. And we're talking continuing the initial 2 doses. We're talking about 3rd doses for populations where a 3rd dose is recommended. And we're also talking about booster shots, which are now recommended by the federal government for all. And also the children, vaccines for children, that's now approved ages 5 and up for some of these vaccines, not all of them. It's a tremendous amount of work to be done. And right now, we feel that it's disproportionately falling on the local public health departments, who are already very, very, very busy in everything that they have to do in relation to the pandemic. So we would like the ability for the committee to approve a letter coming from the chairwoman and me. I think we would co-sign the letter just to memorialize that in writing, the request that we put in last night for our county to get that site back again. And in addition to that, just from the perspective of what the state of New York is asking the local health departments to continue doing every day. They are continuing to handle case investigations exactly the same as they have been throughout the pandemic. Keep in mind, back in June, the state of New York lifted restrictions that were in place generally in the community over businesses, over all the restrictions that we lived with for a very long time that were designed to prevent the spread of COVID, that were designed to, if you will, to contain COVID. When the state lifted those restrictions, the state did not touch the protocols that the local health departments have to do. So what you have now is a state of affairs where we have very large amounts of new cases that we see every day. The public health officials, not just here, but everywhere around the state, are still having to do a case investigation on every single one of those new cases, still having to do contact tracing on every single one of those new cases, have to reach out to all those contacts, and if they're not vaccinated, determine whether or not they're vaccinated. If they're not vaccinated, have to quarantine them. And it's no longer as effective as it was last year when people were not vaccinated and we had the broader restrictions in place. We sort of have half a containment strategy here, and it's burning out. My concern is it's a statewide concern that it's burning out our local public health officials. It's too few people with too few hours and too few days being asked to do too much. We would like to ask the State Department of Health to take another look at this and determine whether or not a strategy that's proving itself every single day based on the numbers we're seeing, a strategy that's proving itself not to be effective, is worthwhile to still be following when it's burning out the people who are closest to us, who have responsibility to protect public health. Janelle is on here on the call in the event that I've misstated any of this, in the event that she can say it better than I have, in the event that anyone has questions for her based on this concept.
And is there a recommendation?
Is there a question, Mr. Well?
Thank you.
Thank you. Go ahead.
Is there a recommendation on how to handle this at this point that we received from this committee to help the state?
Mr. Moore, could you answer that?
I think that goes beyond my expertise to give a public health recommendation to the Department of Health. I think we're really asking for them to take a second look at it, and does it make sense to continue doing the exact same thing that is so labor intensive? We have a situation yet again where our top leadership in public health for the second year in a row has not been able to use any paid time off. That's not a sustainable situation, not for anybody, not even for our public health leadership, who I happen to believe are some of the best in the state.
So is your recommendation that we ask the state to reconsider their current policy and directives? And okay, and that seems logical to me, but what's the solution? I'm not, that's where I'm a little confused. What are we saying we need? Do we need the vaccine site? I get that, okay, I understand that. But from the burnout standpoint of our current staffing and so forth, are we asking the state to participate with that, or I'm not, to send people to help, or I'm not sure I'm confused there.
Well, I think if the state made a determination that these activities are necessary to continue every single day, then yes, to supply their own personnel and on their own time to take more of that on. If the state decides no, that we can loosen up some of these things, we no longer have to. For instance, you have a new positive COVID case come in. What if the state, this is a hypothetical, what if the state decided, okay, we're going to call all the new cases, track all the new cases, make sure that we know how all the new cases are doing and that they're getting better, and if they're not, that we're helping them day to day and giving advice. And again, just a hypothetical. maybe this is the way the state sizes it up. But don't do the case investigations and the contact tracing anymore. Because what you're having for many of these quarantines that result out of contact tracing, you have such fatigue with the whole thing that the quarantines are not effective. So we have all of these administrative steps, all of this time spent in order to get to a point where you've identified these contacts and you're quarantining these contacts, and it doesn't matter at all.
Gotcha. Okay. Janelle, are you on? Janelle?
Yes,
Hi,
I am.
Hi, Janelle. How you doing?
Good morning, or afternoon.
Okay. I assume you've been listening, okay, and heard the discussion here and Administrator Moore's position on this. I'd like to hear your position on all this.
Well, I think there was a time and place for the isolation and quarantines. I think it was very effective before we had the vaccinations. I think it saved lives, and I think we in Warren County, by having low disease rates at the time, saved lives. I think they also were very effective when you coupled that with mask wearing, distancing, limiting social gatherings, et cetera, et cetera. In June, when we opened everything up, we changed everything except the isolations and quarantines. Warren County has stayed right on top from day one of every disease reported to us. We investigate it the same day. We are seeing with our numbers the way that they're skyrocketing right now. I can tell you out of the best of effort, and I say that our staff have done a phenomenal job. It's not containing or controlling COVID in our community. I can give you a small example. We're seeing things fly through the schools. Or I'm sorry, back step. We're seeing things fly through families. If there's a family of 4, chances are the entire family is going to get it, whether they're vaccinated or not. With that said, the vaccinations are doing an excellent job keeping people out of the hospital and hopefully from dying and having very critical illness. But to look at the schools are a perfect example of, we're not seeing a lot of widespread within the classrooms. The kids are sitting 3 feet apart. They're wearing masks. We're hoping that they're not going to school sick. You know, we've got algorithms for the bus and the lunch and everything like that. So we haven't been seeing the transmission in the schools. But I will say that the isolation and quarantines, I think the value of them has plummeted in the control of the disease. I realize it's a very political issue. I can understand that the state's not going to just wake up tomorrow and say we don't have to do that. But the one thing I can say is we are maxed out in our health department right now, following 60 to 80 new cases a day and doing all the maintenance of these, you know, getting the orders, getting the releases and all that good stuff to the cases. So I'm very nervous going into the holidays. If we surge, you know, some counties are already to the point where they've hit their breaking point. We're not quite there yet. But some counties are triaging and they're only calling the kids. Some counties are saying, we're not doing any of the contact tracing. You know, you need to contact your own people, or you need to put your people into this website. Erie County, I think you go online, you show your positive result and you create your own orders. So a lot of counties have done a lot of different things. I do feel strongly if we're able to be successful in pushing back with the state on isolation and quarantines, we could then free up our staff to be able to offer more clinics. With that said, I strongly feel that we need to ask the state for resources to give us the clinic back. And when I say us, I'm talking the multi-county clinic, because we were an excellent site to be able to collaborate with other counties and being able to share our mall site. It was readily accessible. It had parking, very easy to get there, very accessible for like at least 5 counties or more. With the mass clinic, then our staff are then able to kind of go and do the clinics at the schools, or do the clinics at the town halls, or go to the remote areas where people are unable to go to the mass clinic. We're able to catch those. If you notice, when the vaccine first became available in spring of 2021, our numbers were very good. because we were able to get the vaccine out there to the community. And I just would like to maybe focus our efforts on vaccination and testing, which is where we're going to make a bigger difference than quarantining and isolating, where we're not seeing that really do anything for the good of our population. Quite frankly, and I do between 5 and 10 investigations myself every day. When I talk to people, you have the people that are so brutally honest. They tell you every living thing they did for the 48 hours prior to testing positive or their symptoms. They're the people that don't need us. They're just looking for reassurance that they're doing the right thing, and they're very worried that they've infected people, and they're very sincere. Then you have the people that yes you. Then you have the people that you feel are deceptive. And it just, the quality of the information we're getting aren't there, and the abuse to our staff with some of the people and the way that we're treated is not acceptable. And we've started to push back a little bit on the state with doing some of the contact tracing for us. Of course, we're sacrificing a little bit of the quality there because we know our people, and from day one we've done that. But I do think in an effort to keep up with the cases, we've had to do that. I don't know if people have questions, but I think the two biggest things that we need to push back for the state is trying to relook at the way quarantines and isolations are doing to free up our staff time to then focus on testing and vaccination. And then the other thing we need to beg for is that state site back.
Okay, that was a lot. Thank you. Mr. Leggett.
Yeah, thank
And
you.
Mr. Wild.
So to follow up on that, what are the legalities right now if we do not concentrate on the quarantine and isolation that we've been doing?
Janelle, could you answer that, please? Did you hear the question?
I did. I wish I knew the answer of that. I'm a rule follower by nature. When I'm asked to do something, I do it and try to do a very good job at that. To me, that might be more of a legal question, and knowing that we have a fresh new county attorney, I'd hate to put him on the spot, but that's something we could look at. But I will say the public health orders, my understanding for not following them is a fine, and it's very labor intensive to get the fine. And I know some of the people that we've spoken to have said, well, what's the consequence if I don't follow your order? And I'm like, well, we can take you through the court process, and there's a fine, can be daily. And they're like, well, how much is it? Because I'd rather pay that. So I guess I would defer to our legal team to see how much time and effort we want to be behind enforcing our orders. But I can tell you that our local public health staff do not have time to kind of follow up on the people that aren't, in good faith following up on our recommendations.
Okay, thank you. Mr. Wild?
Thank you, Mr. Chairman. Janelle, are you suggesting that we don't quarantine any longer? And I'm concerned about that because those that test positive, I think probably should still be quarantined. But I'm not sure I agree with the full contact tracing of anyone. I agree with you there. I'm just trying to get a sense of the scope in terms of what you were really saying.
I think I'm advocating that we focus on the positives and their households only.
Okay.
I'm seeing some of the extraneous, like I rode in the car with somebody, I went to dinner with somebody, I had a dinner party. Those to me, when you cast that net out, we're not seeing enough of those people becoming positive to be worth our efforts. We are seeing it fly through households. So to me, if I had 10 minutes, I'd rather spend 10 minutes on the household than 2 minutes on the household and 8 minutes trying to track down extraneous contacts. I definitely feel that positive people should be home and isolated from others. But, maybe another thing this committee could look at is asking the state to relook at an executive order saying, if you're positive, you isolate for 10 days. If you're exposed and you're not vaccinated, you quarantine and take the county out of it. Put the onus, when we started telling people if you weren't vaccinated, you need to wear a mask, it was the honor system. If you have the flu, I can't believe I'm saying this, but if you have the flu and you're sick, the right thing to do is stay away from other people. If you have COVID, the right thing to do is to stay away from other people and to notify people that you've been around that, you do have what you have so they can take the appropriate precautions.
Thank you. Mr. Leggett?
Thank
Did you
you.
have a follow-up, Mr. Wild?
No, I'm just trying, thank you, Mr. Chairman. I'm just trying to put my thoughts together so we could maybe come up with some kind of statement or resolution.
That's right, because Mr. Chairman, as this is in front of government ops
Correct.
versus health services, what do you think our role is at this point?
Mr. Moore, would you like to respond?
Yeah, the reason why I asked that this be brought up at this committee is because this is timely. We're going into Thanksgiving and we were asked last night to provide our feedback, which we already did. We already provided all this feedback to the Director of State Ops verbally, but we'd like to follow it up in writing. And so it would behoove us, I think, to get this done sooner rather than later. We were supposed to have a health committee meeting today, but we didn't have a quorum. So we felt that because this is a government operations and advocacy, that this might also be an appropriate place to discuss it.
Absolutely. So I'd be willing to put forth a resolution to guide. But I see Supervisor Wild writing over there. He might be coming up with something to start.
Well, basically, I was just,
Okay,
you know,
hang
Mr.
on.
Chairman,
Okay, yes, go ahead, Mr. Wild.
I was just thinking that based on Janelle's recommendation, my understanding, that we support the quarantining of positive individuals in their households. But we wish to have a discontinuation of contact tracing. And I'm not sure how to end this, but for a certain time or until forever, or until circumstances dictate that we need to do something differently. Maybe it's a new variant or the like, but I don't know how to end that, or we just say we just want to discontinue.
And should we also put in something along that line of our asking for a vaccination site again?
Yeah.
Of course,
I mean, that should be in that same resolution.
Mr. Moore is pretty
Yeah,
capable of coming up with some wording for us, right?
right. Chairwoman Seaver.
Thank you. It's at my request. This is before you today. County Administrator Moore and I spent quite a bit of time last night on the phone. We were very fortunate to be asked to participate in sharing our thoughts with the governor's office, but it wasn't our county and our county alone. Many other counties around us all were saying the same thing. I think if this committee would be kind enough to give that flexibility to the county administrator, to the director of public health, and to me as your chairwoman, to come up with a letter that we could forward on to the governor's office, that would be very much appreciated. First and foremost, it's the request out to the governor's office for our state vaccination center to come back. We know we need to be able to be more proactive and meet a need that isn't being met. Our wait lists fill up very quickly. We're continuing to see people have a greater need than what we're able to respond with. And contact tracing was brought up by Chairman Hall last night too, about the problematic nature of it. So I think we're could be pretty good at getting a brief but very succinct and timely letter out before the holidays. And, we appreciate all the efforts of Sam Parker at the governor's office. He's been amazing, but we need to help with this as well. And I think putting it in writing from a committee such as yourself would be incredibly helpful.
And one other thing, Mr. Chairman, along those same lines, if we could get other counties to sign up on that, I'm not sure
I
if they
think
have
that-
the ability to make that happen, but I'm
Yeah.
sure there's power in numbers.
Yeah, I think it's a time issue and is from what I hear. So although that's not a bad idea at all, I think the fact of getting other counties to sign up in this short of a time span may be a challenge. Mr. Moore?
Yeah, timely was the key word from my perspective is I would ideally like to get this out today. I would like to draft something up today or at least get it out tomorrow or the next day so that it's prior to Thanksgiving. This is going to be, if history is our guide, we are going to see family gatherings result in even more and we are, as you heard Janelle say, we are maxed out staff-wise with the numbers we currently have. And if those numbers continue to go up from here during the holiday season, we're in trouble. We can't sustain that workload and do the vaccinations properly. And the vaccinations is clearly where the time and money and effort needs to be invested right now. And I'd just like to clarify one point, Janelle, you tell me if I'm wrong, but in terms of current quarantine protocol, whether you're a contact or whether you're an immediate family member, I don't believe you have to quarantine if you are vaccinated. Is that correct?
That's correct. You're exempt from quarantine if you're fully vaccinated, meaning 2 weeks after your last dose of the series that you took. And the other caveat is you're exempt if you've had COVID within 90 days of your exposure.
Right. So that's what we'd be talking about, asking the state to eliminate is say, when there's a I believe the proposal that we're sort of coalescing around here is if there's a positive COVID case, we recognize the need to monitor that person and have them away from the general population. But to dispense with the idea of quarantining household members who are not positive and determining all of the contacts that person may have had and then quarantining those contacts that are determined not to be vaccinated. It's a huge amount of labor. And the numbers that we're seeing are proving that it's not effective. And I believe that's the proposal here.
Mr. Wild?
Mr. Chairman, yeah, I'm confused. I thought what we heard from Janelle was that typically a household, it'll spread quickly through a household. So we're not going to quarantine the household members?
I meant household members who are not positive, who don't get it.
Because of vaccination or because they're just immune or what? Because I guess maybe I need to look to Janelle and her comment about what's happening in the household because maybe I misunderstood.
Are you asking that to
Yeah.
Janelle, Mr. Wild?
Yes.
Janelle?
I would look to support focusing on the family, looking at who's living in the house, providing education to the house. Those that aren't vaccinated or have had COVID within 90 days, are exempt. There might still be a few people in that household that might need to be quarantined, but the effort spent on the household is way worth, the effort versus just the willy-nilly community exposures that we're not seeing a lot of positives come out of.
Mr. Moore?
Yeah, that's why I asked about what the current guidelines are, because the current guidelines, if some member of my household, God forbid, is positive with COVID, I'm fully vaccinated. I'm not required to quarantine until such point as I test positive for COVID. So from that perspective, it's a continuation of how it's handled. So that answer the question?
I'm a little confused. Maybe if I see the letter before it goes out, give me a couple hours. Maybe if you're going to get one done today, we can get it out first thing tomorrow morning. But I just want to make sure it follows with what Janelle is saying. She's going to focus on the household. We don't have to do the full contact tracing of where you've been the last 48 hours. And I think that makes sense.
That's a big piece of it. Chairwoman Seaver?
With your permission, Mr. Chairman, may I just address Supervisor Wild?
Sure.
Thank you. Supervisor Wild, I am not asking to do anything more than what the state's already requiring us to do. What we're asking for, what other chairs on the call last night and what your administrator's asking for is to have a common sense, realistic approach to this. And with the ways that the state is still requiring our public health and every other public health to do this contact tracing, it is taking that time away from those vaccinations and boosters and testing. And testing is something that I'm not hearing us talk about, but testing is a major concern. I've asked the state if they would look at sending us those at-home kits that we can give out to the public, to our county employees here, to people that need them, because they are hard to find and they're very expensive. There is a national shortage that's happening with them. And so we're seeing a real limited scope. And when people can get tested, in some cases, there's between being rural or financial status, where the testing piece of it's a real concern as well. So in our plea for this vaccination center to come back, what we're asking for is them to also have the ability to do testing, because if someone could just walk in and get testing done or pick up an at-home kit for someone who's sick, that's a huge advantage and would definitely help. We heard that common theme in this call last night. But I do not want to do anything more than what the state is requiring with our public health. I'd like to see us have some ability to do some advocacy to do less. So that way we can meet the needs and meet them realistically. So I just don't want that misunderstood here. I'm hopeful for a realistic approach. And I don't know if this will really move the needle at all, to be honest. But I do know that I'm back to a daily advocacy effort, which is what I did last spring and summer, and Chairman Hall has joined in that effort with me. So there is some strength in numbers. There definitely were many of us on the call last night, but I don't think in terms of signing on to a letter that, each one will, their chairs are probably already getting ready to just send one.
Mr. Chairman.
Do you have a follow-up, Mr. Wild?
Just an agreement that we shouldn't be doing more. That wasn't my intent. It was just getting clarity on what this is going to look like. And I think this is a valuable discussion. And I don't think that the board as a whole would have a problem with the decision we're moving forward with. So I'm in support.
Yeah, since it's very time sensitive.
Yeah.
Obviously, that's why we're here today discussing it. I know Ms. Bramer had a question, then Mr. Leggett, and then Mr. Moore. You support it. Okay, thank you, Mr. Go ahead, Ms. Bramer. Did you
Thanks,
ever-
Chairman Beatty. I don't have any concerns about the advocacy letter. I think that's great. I just two comments, and maybe one is a question for the county attorney. I know that some people are able to get paid time off of work when they are officially quarantined. So I have a little concern that if we aren't doing the quarantines, that people, are they still able to get their paid time off so they're not going to work sick and still getting paid? Because the last thing we want is people going to work because they don't want to miss out on their income for their family, but they're sick. I don't know. That's one.
Okay, is that a question for our county attorney, or? You froze. Ms. Bramer, you froze.
I think Janelle has an answer to that.
Janelle, could you answer that? And then maybe our county attorney? Janelle, could you respond to that, please?
I'll let the county attorney go for the legal piece of that, but I will say that that is a genuine concern, and that's one of our concerns as to why we don't want to fall behind, is because, people need the paperwork. But what I would propose is that we either come up with like blanket orders that fill in the blank that we could give the doctor's offices, so that, or in the pharmacy. So if somebody, tests positive, they're able to fill in the dates and give the person. Or maybe we could set up some type of local rule that if, you test positive, the employer can take this lab result, or this order from a provider is sufficing for the quarantine. I know that some providers won't take anything but an order from public health. Some businesses will take the doctor's note that they're going to be out for 10 days. And then unfortunately, a lot of our people that are self-employed or that might work for very small employers, it doesn't matter what they have, they don't get paid when they're there, or that they're not at work. So we do definitely need to figure out a way to allow them to have their papers. And I think that's where Erie County came in with their little online self-serve type situation.
Okay, thank you. County attorney, did you want to?
I can't give you a definitive answer on the spot on that. There's some information that the state has provided regarding the availability of some employers based on size to provide and pay under paid family leave, sick leave, or paid time off. But I cannot give a specific answer on what impact the quarantine status would have on an employer's ability to pay.
All right, so where we are is, I think we're all in agreement that we need to do something today, that we need to get a resolution put together. Obviously, asking for the state to have another vaccine site here, Queensbury, but also asking for I won't call it a revision of the policy, but maybe that's what it is. Relief from, that's even a better term. Thank you, Mr. Leggett. A relief from some of the policy guidelines. I think I'm going to ask Mr. Moore to draw that up, to send it out later this afternoon, if you would, to all of us, unless you have it now. And I don't want to put you on the spot if you have the verbiage now, but to send it out to all of us. Yeah, so that we're all in the loop on this, with Ms. Janelle and the chairwoman, three of you, along with the county attorneys, okay on that, so that we're all in good standing. Mr. Leggett, did you have a question?
Right, I'll bring that resolution as stated to the floor.
Okay, so that resolution, so a second by Mr. Wild. Any further discussion on that? Mr. Moore?
Just clarification, we're asking for a letter that's going to be sent within the next couple of days as opposed to a resolution that's going to the
Right.
full board.
Correct.
That's right. This
Thank
is an
you.
authorization.
That's
to send
right.
the letter.
Okay, thank you.
In the form, like you had said, that's acceptable to the county administrator, attorney, and director of public health. Chairwoman.
Yep. So I think we're all in agreement on that. So Janelle, thanks for your input. It was valuable as always. And I think we'll get something together and hopefully we can help, alleviate some of the situation, stress levels. So thank you. Okay, we got that one done then.
Thank you.
Okay, you're welcome. What else do we have left here? Thanks, Janelle. Are we done?
No, the county administrator and the county attorney to research and determine the process timeline for the procedure.
Okay, I'll leave that up to our county administrator. You want to opine on that?
Sure. I did reach out to Senator Steck's staff since our last committee meeting to get their view on what the process would be here. Just as a reminder, County Law Section 200 states that supervisors shall be entitled to the same salary unless they are one of four positions: budget officer, chair of the board, majority leader, or minority leader. Our former county attorney did an opinion on this. Her reading of the statute is that it was restrictive to allow positions on the board of supervisors other than those positions to get that additional compensation, and that applies to the vice chair. The question was asked by Supervisor Thomas whether the state municipal home rule law gives the board of supervisors the authority to adopt that stipend for the vice chair. And her determination was that the municipal home rule law does not grant that authority. What the municipal home rule law does allow us to do is approach the state of New York to make a home rule request for the state to pass state legislation, giving us the authority to then go and do it locally. That's a lot of what you see in the state law, like the mortgage recording tax, for instance. We don't have the authority all by ourselves to impose that additional tax unless we first have the umbrella authority in the state law. So it's a situation that is that's the way we would have to handle it, according to her opinion. I discussed the same with the state senator's staff. I spoke with John Alexander about it. And John outlined what the process would be if the Board of Supervisors does want to go down that road and make a home rule request. And it's the same process that you would follow with the additional mortgage tax. So it involves two resolutions. The first resolution would come from the Board of Supervisors, essentially laying out what exactly we want changed in the state law, what we would like the ability to do. That request goes down to Albany, and the council's office would look at it and research it. And then based on their understanding of what we're looking to do and their understanding of what the law currently allows and does not allow, they would draft up a bill that would change whatever sections of state law or amend whatever sections of state law need to be changed or amended. That process could take a couple of months. So they would get the text of the law written up. They would number it. They would get it onto a committee agenda. And then once it's at that place where the legislation is vetted and drawn up and committed, then we would pass a second resolution out of the Board of Supervisors, which again has to follow our process, go through committee and then to the board, of requesting that legislation be adopted. And that second resolution has to reference the bill numbers, the Assembly bill number and the Senate bill number. So we need it carried in both houses. Typically, you go to your senator and your assemblyman so that you have a version of the bill in both houses, so that we're able to take that second request. So if that's called the home rule request, if the home rule request passes the Board of Supervisors, then you send that that resolution down to Albany, and then it works its way through the home rule process in Albany. It'll go to a home rule committee where it will be vetted by the minority and the majority staff. If it's deemed to be something that both that the majority supports, then the majority will start to work it through the legislative process, allow it to move through committee, allow it to potentially get to the floor of the state legislature and be adopted by the state legislature. This is a process, again, that if the state legislature is amenable to it, could take virtually the entire state legislative session. This legislature's in session until the end of June. If all goes according to plan with a municipal home rule request and it's adopted, then bills, when they're adopted by the legislature, don't immediately go to the governor. The legislative bill drafting office will batch them up. And then the second floor, the governor's executive chamber, will call for batches when the governor's ready to review and to sign or veto bills. That process also can take several months. So, best case scenario, a process like this, if everything just went, really lickety split, you might be able to get the entire thing done from the perspective of getting it out of the state legislature by March, April at the very, very earliest. But more likely, if the legislature is going to do it, you would see it get done, before session ends in June, and then probably be in the hands of the governor sometime in the fall.
Okay, and I believe you're sending that information out, correct, with the chairwoman's?
I believe so.
Yes, okay. So that's being sent to the full board per the chairwoman's request on Friday at the board meeting to have board input. Okay. Thank you for the update.
You're welcome.
Thank you.
Good.
Okay, I'll entertain a motion to adjourn. I believe we've discussed everything. Mr. Wild, Mr. Lager, would you like to stay or can we adjourn?
I don't know. Mike, what do you want to do?
Did we go through number one, the Johnsburg tax map?
To clean up the town?
Oh, thank you. Good catch. Number 5.1, which is the referral from the Finance Committee regarding the abandonment and cleanup of the town of Johnsburg tax map parcel 133.8-1-27, the Mosher's Garage, and to consider exploring the possibility of adopting a local law permitting the county to hold property owners of polluted properties who abandon them accountable and be entitled to recoup any money spent on the cleanup efforts. And this is an update. It was determined the county attorney would review, determine what options are available to the county, and provide an update at the next meeting. And that was in October. And I'm not sure if we do have an update.
My apologies to the board. I missed that one, and I will have that for the next board meeting, absolutely.
Okay, yeah.
Motion to adjourn.
Okay, and second thought, the motion to adjourn. Okay, seconded. All in favor?
Aye.
Opposed?